On Your Health, Teresa Snow shows us how their treatment experience could pave the way for future patients.
Focus on Your Health is sponsored by MU Healthcare.
Along with standard cancer treatments, many people choose to take part in clinical trials. Doctors here call those patients heroes because thanks to them, we have new treatments available. Andrea Greer has always appreciated the simple things, like a walk on a sunny day.
Being with friends, being with family, doing things you love, traveling when you can.
But these everyday joys became even more precious in 2013. Shortly after turning 40, Andrea felt a lump on her left breast.
You say cancer and it's scary.
Andrea opted for a lumpectomy at MU Healthcare's Ellis Fischel Cancer Center to treat her stage 2 breast cancer. But she was also eligible for a clinical trial investigating a targeted therapy drug called Herceptin. Dr. Puja Nistala is medical director of clinical trials at Ellis Fischel and says trials can give patients access to leading-edge therapies and even change the standard of care.
It contributes immensely to the field of medicine.
By 2015, Andrea was in remission, and thanks to her, doctors know better when to use Herceptin in other patients.
Be willing to try something new. If it benefits somebody else, then that's almost kind of a bonus.
Appreciating every moment and hoping her journey will help others down the road. Joining me now is Dr. Puja Nistala, Medical Director of Clinical Trials here at Ellis Fischel Cancer Center. In Andrea's case, she had the standard chemotherapy and the clinical trial was on top of that. But that's not always the case. You don't always have a good option.
That is correct. There can be clinical trials that are designed in two different ways. When there is a good treatment option, and if the question is to see if something else boosts it, we do offer clinical trials such as Andrea had. And there are other scenarios where the traditional therapies may not be good enough, and there could be an investigational drug with better efficacy and safety, and those can be offered instead. So there can be clinical trials that are designed that way also.
Now, these are drugs that we have reason to believe will work. You're not just taking a shot in the dark.
That is correct. These investigational drugs have always preclinical data which ensure safety and efficacy.
Good to know. And this is not just for breast cancer.
Correct. This applies for all cancers, and this is something unique for academic centers over the community practices.
We're glad you're here at MU Healthcare. Thank you, Dr. Puja Nistala. And with Focus on Your Health, I'm Teresa Snow.
Focus on Your Health